Hello, my name is Dr. Adnan Mushtaq. I'm making this video to provide you with information regarding your upcoming surgery. The video will present a brief description of the procedure, the risks and the benefits, and the preoperative and postoperative care. If after watching the video you still have questions, please feel free to ask us during this visit. I hope you'll find the video both informative and entertaining, so relax and enjoy the show. Septoplasty and bilateral inferior turbinate resection procedure. The procedure is performed to straighten the nasal septum and to reduce the size of the inferior turbinate. The indications of the procedure are patients who have failed nasal steroids, decongestants, or the use of the external nasal splints. Benefits of this surgery are improved nasal breathing, more energy because people have more oxygen, and less congestion and need for more medications. I would like to now go over with you the preoperative care and instructions. Please report to the surgery center or hospital that has been designated on the sheet that has been provided to you by our staff. Do not eat or drink after midnight the night before surgery. No alcohol consumption for at least 2 days before surgery. No smoking for 4 weeks before and after surgery. And you must have a responsible adult accompany you home. Please bring a photo ID with you and leave your valuables at home. You must pay your patient portion during your preoperative visit, and we encourage all patients to call the facility and the anesthesia department before their day of surgery to find out what their policy is regarding payment, either before the surgery date, during the surgery day, or after. If you wear contact lenses, please leave them at home and wear glasses. If you do not have glasses, please bring a contact lens case and saline solution. Please remove all of your makeup and at least leave one finger in each hand without any nail polish in order for proper oxygen monitoring. Please wear loose, comfortable clothing. A workout clothes with front full zipper is usually the best. Please do not bring any jewelry. Bring all of your medication bottles on the day of your surgery. The anesthesiology staff and the nursing staff will most likely record your medications. If you take medications in the morning, please take your dose that is usual and take it with a sip of water only. If you are a diabetic and you take insulin, then please take half the dose of the insulin of the morning of the surgery. If you have a history of a heart murmur, then please consult with your surgeon regarding proper antibiotic prophylaxis. Do not take any aspirin, ibuprofen, or aspirin-related products such as Aleve for at least 10 days prior to surgery. If you're taking blood thinners, please inform your surgeon during the preoperative visit for appropriate timing of stopping those medications and restarting. If you are under the age of 18, you must be accompanied by an adult who's your legal guardian during your preoperative visit. Risks of the procedure include bleeding, infection, hematoma or a blood clot, bruising, pain or numbness of the nose, specifically the nasal tip area, teeth, and face. Septal perforation, which is a hole in the septum, which can occur. Also, variable flow between the two sides. No matter how much we try to give equal amount of space on both sides, patients will always detect more flow on one side more than the other, which may appear as possible blockage, but in fact, they will have adequate flow on both sides. Despite our main efforts, patients may continue to feel some degree of nasal blockage, internal scar formation, tightness sensation of the nose or the facial skin, rare cases of possible skin slough, meaning the skin sloughing off of the nasal tip or inside the nose, soft tissue loss, again, possibly due to lack of blood flow to the tissues, change or loss of smell sensation. These are exceedingly rare complications. The septoplasty and turbinate resection procedure does not change the shape of the nose. However, sometimes due to instability of the nasal skeleton, slight changes can occur, although this is very, very rare. After the surgery, patient can experience sometimes slight swelling of the face or the nose, and this should be transient and should resolve. The incision is inside the nose. However, in some people with larger nostrils, the incision can sometimes be visible if looking from below. The surgery, again, should not change the shape of the nose or present any irregularities. However, again, depending on the thickness of the skin and the extent of the surgery, sometimes slight irregularities can appear. Due to the nature of all surgeries, sometimes outcome cannot be predicted due to various factors, and therefore there may be a need for further procedures to take any corrective measures. There are rare complications such as airway obstruction, stroke, cardiac arrest, and death, which can occur with any and all surgical procedures. Again, these are exceedingly rare. Complications related to anesthesia will be discussed by your anesthesia staff. The surgery requires a general anesthetic procedure. The duration of the procedure is approximately 1 hour, and then the patient is usually in the post-operative care unit for anywhere from 30 minutes to 2 hours. Here is a typical example of the positioning of the patient as well as the surgeon, usually on the right-hand side, and an assistant on the other hand side. A brief description of the procedure. Septoplasty involves making an incision inside the nostril, which allows us to elevate the lining off the septum, which is cartilage and bone. We try to reconfigure as much of the tissue as possible, remove the areas that we can't reconfigure, and then stabilize the septum and then close the incision. Everything is done from inside the nose, so usually there is no visible incision at all. The turbinate resection part of the procedure involves reducing the inferior turbinate only. The turbinates are valves that control airflow, and in some individuals they are enlarged due to either their natural anatomy or allergy response. The turbinate is partially crushed with a special clamp. Excess tissue is removed. The turbinate is then cauterized and then outfractured to create a more open nose. Nasal packing. The nose is usually packed on both sides with plastic splints and cotton gauze covered with antibiotic ointment. Here is a typical example of the Vaseline gauze covered with antibiotic ointment and the plastic splints. They're stitched into the nose, and they allow for the gauze to be removed relatively painlessly on day 5 or 6 after surgery. And this is what the patient looks like after the packing has been placed inside of their nose on both sides. Post-operative care. The big don'ts are: please don't blow your nose, don't do any heavy lifting or exercise for at least 3 weeks, don't sneeze through your nose, pinch your nose if you feel like you have a sneeze coming on, don't fly for at least 2 weeks, and avoid climbing stairs, although when you get home you may certainly go up to your bedroom if it's up a flight of stairs, and you can also go up and down during the day, but try to minimize the number of trips up and down. Continuing with the don'ts, please don't smoke. It's ideal if you are smoking to stop at least 4 weeks before surgery and continue 4 weeks after, although we encourage people to stop altogether. Don't drink any alcohol, especially until the packing comes out. Alcohol thins the blood and may cause problems or may cause you to lose your balance. Don't drive home from the surgery center. You must have a legal guardian that must accompany you home, and that cannot be the taxi cab or Uber driver. You can drive the day after surgery, although again you have to be very careful because you have packing in the nose. You may sneeze or have bleeding. We also encourage people to be active after the surgery. Don't just lie around in bed. Try to walk around within your residence. It promotes a good blood flow in your extremities as well as getting the lungs re-expanded. Side effects after surgery are feeling of nasal stuffiness and pressure. Pain is usually not a symptom after nasal surgery. You have to remind yourself to open your mouth and breathe. Most patients have the surgery done for nasal blockage, so therefore this is not a big change in their life, although you will be much more stuffy than usual. Keep your head elevated on pillows if possible, or a mattress wedge that relieves the pressure off the face. Patients also tell us if they used a humidifier or a vaporizer at the bedside, either cool mist or warm mist, that makes them feel just much more comfortable. Ice water soak washcloths over the eyes and the upper forehead also make people feel better. There'll be a white piece of gauze underneath the nose, which we call the drip pad. It will be held there with either a plastic drip pad holder or just with tape. You may change that drip pad as much as needed. The nurses in the discharge area will give you and your family members extra drip pads to take home. And again, this will go from being bloody to pink to clear over the subsequent days. Reasons to contact us after surgery. If you're having any difficulty breathing or severe bleeding, then you should go to the emergency room and have the emergency room staff contact or call the physician on call. If you're having just a slight blood-tinged mucus coming out of your nose, that should usually stop with some manual pressure at the base of your nose. If the bleeding becomes active or you're beginning to cough up blood, then please call the office and ask for the physician on call. If you experience temperature above 101, then also you should call the office and ask for the physician on call. Low-grade temperatures such as 99 or 100 sometimes is common after the surgery. Most patients do not experience significant pain after nasal surgery. Most of the time, the pain can be managed with extra strength Tylenol. We ask our patients to grade their pain from 0 to 10. If it's 0 to 2, then please don't take anything. If it's from 3 to 5, then you take extra strength Tylenol. Please don't take any aspirin or aspirin-related products such as ibuprofen, Advil, Aleve, or any other related products. If the pain level gets above grade 6, then please take the prescribed narcotic. Patients are usually prescribed oral antibiotics after surgery. Patients are also given antibiotics during the surgery. Therefore, we tell all patients that if you're feeling very nauseous, you can start the oral antibiotics the day after surgery. Otherwise, if you're not too nauseous, then please start the antibiotics the night of surgery with some food. Patients are also given anti-nausea medications, and please take that as directed. We give patients anti-nausea medications by IV during the surgery. However, some have significant sensitivity to anesthesia and therefore may require some anti-nausea medicine. Occasionally, patients have significant amount of anxiety, and for those individuals, we also prescribe anti-anxiety medication. The warning that we give all patients is please do not take the pain medicine and the anti-anxiety medicine because they both can depress the respiratory system, and therefore one should take either one or the other, and we ask them to stagger each one of them by at least 2 to 3 hours and not to take them together. Diet. We recommend soup or pasta the night of surgery, something very, very light. That way you don't get nausea or vomiting. Very important afterwards to maintain hydration. You can do that with water or any sort of a electrolyte type of drink if you desire, preferably no alcohol because that can thin the blood and cause bleeding and cause you to lose balance. Also, we do not recommend any cigarette smoking, vaping, cigars, or any hookah or any sort of inhalational agent such as that because it causes a lot of problems with the respiratory problems as well as inhibits proper healing of the nose. Activity. We recommend walking around in your residence. Don't just lie in bed. It promotes increase lung function as well as getting circulation back into your extremities, taking deep breaths in and out to try to re-expand the lungs. Immediately after surgery, please do not try to do any heavy lifting. If you drop anything on the ground, try to squat and pick it up without bending down. Try to keep the head above the level of the heart. And if you do have to lift anything, make sure it's very, very light. No exercise for at least 3 to 4 weeks after surgery, depending on how your healing is coming along. If you're having bleeding, then you may have to even take longer time. Recommend a light walk around the house or residence, or if you're dying to get on the treadmill, you can do a light walk 2 weeks after surgery. Post-operative wound care. The packing is usually removed 5 to 6 days after surgery, although in some patients the packing can be removed within 2 or 3 days. We treat each patient individually. For those who have a lot of anxiety, the packing can be removed early. However, there are risks of bleeding and scar formation if the packing is removed too early. When you arrive at your postoperative day, the packing will be removed and you'll be given instructions on how to clean and spray your nose with saline spray. We recommend using the spray every hour to every other hour for the first week, and thereafter 3 to 4 times a day. All patients are shown by the staff how to clean the nostrils with peroxide and saline or just plain water, mixture half and half. And the nostrils are cleaned with a cotton tip applicator or Q-tip, and then bacitracin ointment is applied. And again, this is done for approximately a week. You may notice some brown sutures falling out, especially from the right side of your nose, and those are absorbable sutures that are supposed to fall out. We again really advise patients not to blow their nose because the lining of the nose is very, very fragile and they can have an active bleed. That's why we recommend using saline spray instead. What to expect postoperatively? Most patients note immediate improvement of airflow on the day of the packing removal. However, you'll start feeling some congestion as the day goes on, and that's because of the postoperative swelling. Most will say that optimal flow from the nose occurs anywhere from 1 to 3 months after surgery. One of the common complaints that some patients have is that they feel that both sides are not equal in the airflow. And the reason for that is because the internal anatomy of each side of the nose is always a little bit different. And there's sometimes more allergy affecting some of the tissues on one side more than the other. Therefore, the flow on both sides will never be equal, is what we tell people. However, it will be significantly improved from preoperatively. Another complaint that some patients have are sometimes when they're touching the tip of their nose or taking a shirt off and it touches the tip of the nose, that they feel very sore in some areas and numb in other areas. And again, that's because the incision is located near the tip of the nose and some of the nerves are either severed or stretched. All of the sensation becomes much more normal, but that can take several months to a year. People will also notice crusts and clots coming out of their nose when they're doing the nasal saline irrigations. And again, that is normal and expected, and that usually stops over a course of 1 to 2 weeks. Post-operative appointments. After your first post-operative appointment on day 5 or 6, your next appointment is usually 3 months after the surgery. If you have any problems during the interim, we will be happy to see you anytime. Just please call our office. That concludes our video. I hope you found the information helpful. If you have any further questions, please feel free to ask us now. I would like to thank you very much for your time, and I wish you the very best for your upcoming surgery.